Afternoon, everyone, and welcome to this edition of Tuesday at the Tech. My name is Gail Lindsay. I am Dean for the School of Nursing, and today we are going to spotlight our clinical partners and discuss the opportunities that you would have as a student, a nursing student here at Ivy Tech, and the opportunities that you would have once you graduate from Ivy Tech. So, ladies, I am going to let you introduce yourselves.
We can go first. So I am Jessica Miklo. I'm the Recruitment Retention Recognition Coordinator at St. Vincent. I'm in charge of the Student Nurse Intern Program.
My name is Madison Feith. I am the clinical coordinator here at Ascension St. Vincent Evansville, and I do more of the clinical side of things, but work very closely with Jess.
My name is Mackenzie Davis, and I am the nursing graduate recruiter here at Deaconess.
My name is Ashlyn Stansberry, and I am also a recruiter here at Deaconess. I recruit specifically for our Student Nurse Academy.
Ladies, thank you so much for joining us this afternoon. So my first question to you is, so we utilize both Deaconess and St. Vincent's when students are in the program in order for our students to see the vast majority of opportunities that are here in Evansville and to experience different units such as cardiac, such as ICU, ER. But what other opportunities are available to the students that are in the program?
We have quite a few opportunities for students. If you're a first semester student, we have a nursing apprenticeship program where students work part-time with us, and then we pay for their school with a 2-year commitment. We also have a student nurse intern program that any semester is eligible for this. They can be placed on a home unit to gain experience, kind of an area of their choosing. And then we also have shadowing experiences. So if a student doesn't want to commit to a job, but they want to gain experience in a certain area, we can also set up those experiences.
So we, of course, have our Student Nurse Academy that is specifically for our nursing students. They come in after 1 semester of clinicals. They'd be eligible for this program. We place students in almost all of our inpatient units at all of our campuses. Just one-on-one time with an RN. There is our requirements that come with that depending on the session that you're in. But we have 3 sessions every year, spring, summer, and fall. And we also have, of course, PCT opportunities and shadowing opportunities as well. If you wanted to shadow before committing to any type of position with us.
Okay. And that leads into my next question. If you have someone, a PCT, maybe someone in a dietary that is interested in nursing, and they come to you and say, I'm not sure. How would you direct them? And as you know, Mackenzie has said, you guys have the opportunities for shadowing. What else do you have available for that person that's unsure and has not been in healthcare?
So usually when someone is unsure about nursing in general, I always kind of direct them to our resource team as a patient care tech. That way you're still getting that hands-on experience, but the resource team allows you to see all different units. It is kind of like our supplemental position, so the hour requirement is very low, but you're able to pick up on a bunch of different units, so you can kind of see all the different units at the campuses that we have.
Usually I would offer to do a tour for students, kind of show them the lay of the land in the hospital. And we also have a feeder program with what we call our NRC, so nurses that kind of go all over the hospital. This would be more for nursing students that don't know where they want to go, but it's a program that an actual nurse graduate could go learn how to be a nurse on several different units until they figure out where they want to end up. So that's always a great opportunity if there's a nurse that doesn't know where they would go. But yeah, tours probably number one thing that would be career shuttling.
Okay. What opportunities do you have for those students that are in program and they may need that extra little um, push because they may be having some difficulty with med surge, they may be having some difficulty with pharmacology. Do you have something that you could assist those students with that are that are working for you?
We have rooms we can reserve for study groups. We don't have anything necessarily instructor led, but we offer lunch and learns for our associates. So these are all different topics we do every month. So on our shared governance day. So all associates are welcome to come to this, learn about different topics, eat their lunch, hang out with peers. But it's a great opportunity, not necessarily specific to a nursing class, but at least we get some education around it. Some of them have like CEUs you can get for certifications, but that or we always recommend students to contact us to rent a room if they're needing a safe space to study.
So we also do lunch and learns. We don't have any, like Jessica said, instructor led like help with specific classes or anything while they are in school. But we do have an SNA coordinator. So she's a great resource. Her name is Amy Lloyd. She used to be out at USI, but she would be a great resource. If you just needed some extra help, she's great. She has great contacts at all the schools, all the local schools. So she would also, be willing to reach out and try to find some help for that student if they're struggling in a specific area, or, even if it's just like struggling with mental health, she's also a great resource too.
Okay, thank you. So I'm in my first semester and I have no experience at all in healthcare. What would your advice be for me if I came to you and said, when should I apply and what should I apply for?
I just always tell students, because I get that question a lot teaching clinical, I tell students the sooner the better, because the sooner you get your foot in the door, the more experience that you're going to gain, and the more opportunity you're probably going to have to see different things. When they tell me they're unsure, a lot of times I guide them towards med surge because they're going to see multiple different things, or if they think they like something, I do suggest to shadow or do a student nurse internship on a unit if they're employed with us. To make sure that it's really what they're interested in before they assign themselves a position there. Because I think a lot of students in the first semester think they know what they like, but once they get there, it's really not what they thought it would be. So just starting as soon as possible and mainly keeping an open mind.
Also agree with that. As soon as you can apply, I definitely would. Just so you can see as many areas by the time you graduate. You are able in our Student Nurse Academy to move each session, but there are so many different areas that even moving each session isn't going to let you see every single thing. And the earlier you are to apply and get that seniority when you're in your last couple of semesters, it's a lot easier to be placed in one of those harder to get into ICUs or emergency departments or women's health and things like that.
Okay, so I'm graduating in December. What are you going to offer me?
So we have lots of opportunities for current graduates. We've got tuition reimbursement, we've got competitive pay, we've got sign-on bonuses for day shift and night shift. We have a new pilot program coming out with opportunities to grow. We pay for certification. Yeah, we have an adopted nurse mentor program where an older nurse, a more experienced nurse will mentor a nurse graduate for their first year to kind of support them and encourage them during their first year as a new grad.
There's some unit-based things too. Some of the unit leaders do some like lunch and learn things for continuing education and just to check in with the new students. But I think Jess and McKenna do a very good job of trying to pair students with someone in their appropriate service line too, to make sure that they really create a good connection and hopefully create good outcomes for that student in their first year.
So we also offer tuition reimbursement for our nursing graduates. We have student loan forgiveness. Whenever you come in as a nursing graduate, we have a nurse residency program that was recently PTAP accredited. So that whole first year really helping you get through all the challenges and changes that come up with that. We do monthly educational courses and then just open forum debrief afterwards, where you're with all of the different graduates around the health system. You may be one of a few on your specific unit, so it's a good way to get with the whole group, just to have those added resources there as well.
So I know that my associate is not where I'm going to stop. I at least want to get my bachelor's. What assistance would you provide me with that?
We do partner with a lot of schools for our BSN programs. We actually provide like discounts through those schools that we partner with. We've got tuition reimbursement for students that want to go back. Kind of varies if they're full-time or part-time for how much money they get.
Yeah, I checked in with the schools recently that we partner with, and I think there's some schools now that being an Ascension associate, you can get up to like a 15% discount on your tuition. And then as Jess said, it depends on your status here at the hospital. We do offer tuition reimbursement as well for that. And then if you decide to get a certification in your area as a form of continuing education, we will also reimburse for that as well.
Okay.
Doing all of that with tuition reimbursement. We do partner with some different RN-to-BS programs as well. We have a really great education team here that can help you with all of those things going forward, and kind of mapping out what your next plans will be for obtaining your bachelor's and anything that comes after.
Okay. So our next application cycle begins in March 15th, and it ends May 15th for our ASN and LPN program that starts in the fall for the fall cohort. What what words of encouragement or what would you say to those students that are looking to apply for or
That's a little bit cut out, but I'll do my best. So I would tell students to go for it, to always ask questions, try to be prepared, go for everything their teachers are telling them. I work very closely with a lot of the first semester students and know a lot of them get overwhelmed very easily. So trying to teach them things like time management and using a planner and to keep them organized. But I know Maddie and I always encourage them to come to us for support and talk to their teachers. And if they're struggling, go meet with your teachers and try to give them a lot of advice in the forefront that they can use for the next 2 years.
I also always tell them it's a lot of new. So you're starting a new program, you're basically starting a new job. Even if you're not employed, clinical is ultimately a part-time job. So, you're working, you're probably caring for a family, you have, job responsibilities outside of work. And there's so many new things. So going back to what Jess said, just learning how to manage your time and, balance all your responsibilities. And then I just always tell them, advocate for yourself and rely on your resources to help you succeed and reach for that end goal that you obviously have a desire to achieve.
I tell them mainly you're not alone. There's so many other students going through kind of the same process that you are right now. So whether you are coming to your school or to one of either Deaconess or St. Vincent, there's great opportunities and resources with all of that. And echoing what you said about Amy earlier, she's a really great resource. I know her office is always open as well as ours, but we can talk you through whatever you need, whatever we can help you with. But good luck and welcome.
Yeah, And even, your student unit managers, if you're already working as a PCT, they're always great resources to your unit leaders, even, an RN on that particular unit that you're working on, that you've been keeping close with. I know that a lot of our preceptors are always willing to talk to students. They love talking to students.
And they all started at the same exact spot
Yes.
that you're in right now, so
Yeah.
definitely good resources there.
Yeah.
So I want to say thank you to each and every one of you for joining us today. St. Vincent's Deaconess, absolutely great in this community. They support Ivy Tech 100%. So we look forward to seeing you here at our recruitment events soon. And thank you for joining us today for Tuesday at the Tech. As I stated, our next application cycle opens March and ends in May. And if you need information, please go to ivytech.edu/nursing. And there is a great deal of information there for you. My name is Gail Lindsay, GLINDSAY at ivytech.edu. My direct line is 812-429-9837. There is no question that you should have that can't be answered. So, especially when it comes to the application process. So we look forward to hearing from you soon.